All right, let's talk about this myth of nighttime awakening. What does that mean? So let's say you're one of those people who can fall asleep super easily, right? You're one of those people who can fall asleep easily. I hope you got that reference. That's Police Squad. I hope you're a nerd enough to know what that is. But anyway, so if you have difficulty staying asleep, that's a different problem. Remember, we have two main insomnia problems that we're dealing with: the inability to fall asleep and the inability to stay asleep, right? You're waking in those midnight hours. Most people will tell me, our assumption is that we're waking up because of anxiety, and that connection makes a ton of sense. When we finally realize that we're awake, our mind's normally spinning its wheels, right? And the truth is, there's normally some preceding event that stirs you. And in that mid-awake state, your mind starts to do the Tasmanian devil nonsense, right? That's my impression of a Tasmanian devil from Looney Tunes. Waking up in the middle of the night normally points to something, some other problem that's waking you up, right? And let's call that like a biological problem, right? Because there's a cause. There's something potentially medically wrong that needs to be addressed, and it can be a problem. So you need to pee, right? You have a hot flash. You're in pain. You have 2-year-old triplets that howl like wolves in the middle of the night to get your attention. And I wish I was making that last one up, but that's what my kids did. Rowan would howl. I called him Teen Wolf, right? Ava, the podcast executive here, she used to say, scream at the top of her lungs just because she wanted everybody to wake up so they could hear how loud she could scream. And this is at 2 a.m. So your body has this issue. There's something going on, and it says, hey, wake up, right? Just like my kids would say, hey, I've got an issue. Time to wake up, right? And, it's rallying you, and it's trying to get you to pay attention to it so the problem can be addressed. So, for most of us, sleeping soundly through the night will only happen when you finally address that thing or things that are waking you. So if you have babies, here's my recommendation. You put them in a dog kennel a couple floors down, then you won't hear them screaming. I can't even. Seriously, though, parents that reach out to me about their insomnia, I just say, got to white knuckle it, man. So you can work on the baby sleep habits, but hopefully this is something that they're going to age out of. If not, they got to go in the basement or in the shed or something. So there are a number of things that aren't our kids or dogs that can be a problem, right? The us things. And I want to highlight 3 main problems that wake people up in the middle of the night because it's really important to talk about these 3 specific things. The first problem, breathing difficulties and sleep apnea, okay? If you're waking up in the middle of the night and you can't put your finger on it, right? You can't find something obvious, no doggy, no kid, no bladder, nothing like that, right? I recommend a sleep study. There's a chance that you might have a mild apnea that's been undiagnosed, or at least that's what my sleep doctor friends have told me and advised me to tell patients. These breathing problems don't go away and they can lead to severe problems. And so if there's any chance that it's difficulty breathing or related to that in any way, don't delay. It's time to tag in an expert as soon as possible. And guess what? If you don't know, if you don't have a reason that you're waking up in the middle of the night, that's another great reason to tag in an expert. So waking up in the middle of the night is medical. And if you can't say clearly that there's something that's doing it, you got to see an expert, and that expert may test you for breathing problems, and it may be slight, but it may be enough that could accumulate over time. And certainly it's disrupting your sleep, so it should be addressed. So the second thing is this cramping or restless leg syndrome. So, just a semantics thing to talk about. Restless leg is a very specific neurological condition, okay? A lot of us experience twitching or cramping, but it doesn't necessarily mean that you have restless leg syndrome. So if you're cramping and twitching, it doesn't matter what you call it. It just matters that it's disrupting your sleep. So let's address that. And if we live a holistic life, we'll do those wellness practices regularly, right? And those practices should include good hydration, getting hydrated, as we said on earlier episodes, or even stretching. Those kinds of things are great wellness practices for a number of reasons, but certainly for somebody who's legs and extremities are cramping up or twitching while they're trying to rest. But if you're checking off all those boxes already and the cramping persists, a short course of something like chelated magnesium can help relax those muscles a little bit, or even a topically applied magnesium gel or cream. It's worth a shot trying, but if that doesn't work, it's time to tag in an expert, right? Finally, the bladder problems, right? And this is me. This is my sleep problem. This is my deficiency. I'm up 2 to 3 times a night peeing. And it's, again, I'm not judging myself. I know it's all me. It's my fault. And it's not my bladder. I know clearly that it's not my bladder because I drink, 3 10-ounce glasses of water or booze. No, I'm just kidding. Water between 8 and 10 o'clock to get caught up on the stuff that I missed during the day. And I'm super thirsty, right? And so I know that for me, it's the fluids. So here's my advice to anybody that's getting up in the middle of the night to determine what's really going on, right? So if you're waking up to pee, cut yourself off for a few nights, right? So 3 nights, make it 3 hours before bed that you have no drink. And if you have food, make sure it's not rich in like water. So like don't eat a watermelon, don't have lots of ice cream or smoothies or something like that. And so if you do this strictly, you cut yourself off 3 hours before bed for 3 nights and you're still getting up, that's a good sign, right? You've done a great experiment. You now know that there may be a bladder or prostate or urinary tract issue that needs medical attention. Tag in that expert as soon as possible, right? And so, again, these are the 3 common reasons folks wake up in the middle of the night, at least what's presented to me. And I wanted to address them because, it's all 3 of those things are common, but all 3 of those things could be signs of something serious. And just because you're not sleeping doesn't mean it's something that a doctor shouldn't be involved in and a doctor shouldn't help you with. So just make sure that that's part of our conversation. So in our holistic care plan for nighttime awakening, I believe it's called maintenance insomnia, if you were looking at the official definition, it involves identifying the cause of the problem and then addressing it, right? But you may be saying to me, but Neal, who cares? I'm awake right now. What do I do? And now we see the other part of the real issue. The first is what's awakening me, right? And the second issue was how do I fall back asleep? So, right? Waking up in the middle of the night is not a 1 problem thing. It's a 2 problem thing. It's addressing the thing that's wakening you and then trying to fall back asleep, right? And how do you fall back asleep? Well, simply, right? That's what we just talked about in the last segment. You need a calm mind, a calm body, and a comfortable environment, and then you'll fall back asleep. But I've also been a human for long enough to know that that's not true either. Sometimes you're rested enough and you have a choice to make. So do I take something to induce some drowsiness and fall back asleep? Or do I get up, be productive for a little bit, and then fall asleep later? Right? Is it wiser for me to get up now and just be a little bit tired throughout the day and maybe go to sleep earlier tonight? Or do I lay here and try to put my brain in a rear naked chokehold and win and go back to sleep, right? And this is a personal decision. This is something that you have to kind of think about. I think no matter what, though, you're going to lose, right? There's no real good decision here, and because we've all experienced this, right? We're going to discuss medicines and supplements in other segments, but you can be sedated the next day because of what you chose to take, right? You could be sluggish and tired because you chose to get up early and just do your thing, right? You might be a little bit more productive in those hours, but in general, your day is going to be kind of not the same. And you could also be dragged out because you were up for an hour or 2 trying to get yourself to go back to sleep. And when you finally did, it was too close to being awake again. So like I said, there's almost like no winning when you wake up in the middle of the night. And that's why it's so important for us to really address the thing that's causing us to wake up to begin with. But, the theme here is to simplify this for you. And I hope at least this has been enlightening, right? So if we wake up in the middle of the night, we have 2 problems that we have to solve. Addressing that cause, what woke us, and how do I stop that? And how do I easily fall back asleep, or do I even bother?